I'm Rachel Hopkins MP for Luton South, and I'm Vice Chair of the All-Party Parliamentary Group on Arts, Health and Wellbeing, and I'm very pleased to be chairing this meeting this morning, at least for the first hour, as unfortunately I have to head off at 11. We've got some fantastic presenters lined up, and including our wonderful children from Cambridge. So I'll just move through the agenda. We're going to hear a range of presentations about some of the projects people have been working on, particularly with young people, co-production and creativity when it comes to mental health and mental health services. So without further ado, if I link into Paula with Branching Out and the team there, and do you want to talk us through the project you've been working on?
Thanks so much, Rachel. I'm Ruth Sapsed, and I'm Director of Cambridge Curiosity and Imagination, and we're going to talk about Branching Out. Branching Out is asking how we can help more schools enable more children to have arts in nature experiences. We call this artscaping, to embrace the idea of how we can explore and change ourselves and our world through making art together. I'm here with Paula, but also these brilliant expert artscapers, Alana and Erin and Imi, and they're going to explain more in a minute. For CCI, our journey as artscapers began when we became a charity 15 years ago, horrified at what we saw at the drying out of children's lives, with their creative freedoms being ever more stripped away. Freedom to move, to imagine, to ask questions. Whilst Cambridge as a city celebrated for its world-class universities, it's also been awarded the less flattering description as the least equal city to grow up in here for several years running. There are stark inequalities in our city. Branching Out is going to learn how schools can build greater capacity for more artscaping. It's a full scope programme where voluntary sector organisations in the region are working in partnership to help the mental health system become more inclusive, more accessible and more relevant to children, with greater emphasis on prevention. We're working with family therapy charity Cambridge Acorn Project and research partners at UCL Institute of Education and Anglia Ruskin University, and we're building on a strong evidence base of the impact of our artscaping opportunities on children's wellbeing from the Eco Capabilities Programme led by UCL. Crucially, we're working with expert young artscapers at Mayfield who understand the practice and are helping us co-design the resources for new schools. And this process literally just began on Friday. So I'm going to ask Paula to tell you more about Mayfield and why they are helping us out with Branching Out.
Yes, hi, I'm co-head teacher at this school. We've got pupils, about 400 pupils, two-form entry school, and we have children from all over the world. Some have additional needs of one type or another, but all of our children have many skills and many talents. But increasingly over the last few years, we've been aware that the pressures of our modern education system is not being helpful for some of our children. We have lovely, lovely grounds here, don't we? Beautiful grounds, and they were always underused. We always wanted to use them. We didn't know how to use them. And about 6 or 7 years, Cambridge Curiosity and Imagination were given a project to do at a new local site, which we now call Eddington, and where we went with our children and CCI to help develop that site and to use the outside, use art in nature. And when we went, what we saw our children achieve and do together blew our minds. And so we didn't want to leave it there. We needed to take that back into school. And so as a school, we do something called Out and About, which means that every child in every class has half a day out of the classroom every week, whatever the weather. And we spend that time outside in nature. And we're now in our 5th year of doing that. And as a result of our participation in that, I'm now an advisor on the Eco Capabilities Project with CCI, and now this Branching Out project too. But enough from me, because we need to hear from the experts, the children themselves who've been out in nature for the past 5 years, one afternoon a week. And they're going to tell us this morning what it's like to spend time in nature. So what does it feel like to be outside in this way as an artscaper or in one of our Out and About sessions? Alana, do you want to go first?
It feels really good because you're given kind of freedom, because in like lessons, you're told what to do and you're given a worksheet usually, but when you're outside, you're just given a tiny bit of input and then you can do the rest yourself.
Erin, what about you?
Yeah, so because
if you inside working, it might be quite noisy, you might not be able to concentrate, you might find it quite stressful. But then if you do out and about, you can go in, you could just go like be with yourself, you can go find a nice quiet space to do your work and then just relax. I think that when it's outside, it gives you so much more opportunities to be creative and show your true personality than if you're sitting in a classroom learning times tables. And it's really important that we all build on our love for the outside, because it means that we can all have a deeper appreciation for our world. And if somebody says being outside isn't real learning, I say that learning isn't sitting in a classroom and learning 12 times 12. Learning is discovery, and learning is finding out new things. And there are so many new skills that you wouldn't learn if you didn't do them outside.
Brilliant, thank you. So you had your first Artscape session on the Branching Out project last week. Do you want to say a little bit about what that was like? Do you want to show what you did as part of that? Amy, what about you start, and then Erin and Alana after that?
So first we sat in a really big field, and instead of telling us to walk to the little garden that we have in the corner of the field, they gave us blindfolds for like one child in a pair, and we were supposed to describe what it was. And you could take your own take on what your partner was saying. It could be anywhere. It could be a meadow or a forest. And then we had to draw cow parsley. But it wasn't just drawing the plant, it was drawing how you felt when you saw the plant. And when I looked at the plant, it looked like a forest. So I drew a forest and all the bugs that were climbing up my legs.
Erin, what about you?
Yeah, so it was just really fun because they just told us, in my group, they told us, just like find loads of, just find bits of nature and then make artwork with it. They didn't tell us what to make. They didn't tell us how to make it. They just said, make some artwork with it. So we went around finding leaves, flowers, anything that wasn't still intact with a tree or a bush. And we made like massive pieces of artwork with them. Yeah, when we were drawing the cow parsley, one of my friends, she just sat in a little ditch that was surrounded by cow parsley, because they were saying like be one with the cow parsley, and that you could smell it and feel it, to get your own description of it.
That's so brilliant. What advice would you give to adults, to new adults who want to work like this with children? What do you think is really important that adults know about?
I think that don't give them set rules. Give them a frame that they can build off of and create their own world that will really help them broaden their imagination.
What do you think?
Yeah, because if you just tell a child, do this, do it like this, and don't do anything different from this, they won't find learning fun. They won't enjoy the learning. They won't connect with the learning. But if you give them a loose structure for them to build on, they can build around the structure and do the work and have fun doing the work. Yeah, and also let them see each other's work, because lots of people did it differently. Some people just drew the cow parsley, and some people, like Amy, they did what they felt like or what it looked like to them.
So how does being out and about, being outside, how is it different from being in the classroom? What benefits? Why is it such a good thing to do?
In the classroom, it's loud, it's noisy. So it might be warm or cold, but outside the sky is open, there are trees, and if you have all of these senses on, and you can see how it's always different every time you go outside, it's so much more memorable, and you're much more likely to remember and enjoy your experiences.
All right, anything?
Yeah, because if you're stuck in a classroom, have any freedom, it's just mechanical. But then if you're outside, you get freedom to do what you want to do, but you're still doing the work. You're in a classroom, you can look out of the window and you can see what you see. But when you're outside, you feel more connected, because like instead of just drawing like a tree with the leaves, you could like change what the leaves feel like to you, what they remind you of. And they don't have to be like the same.
When we were talking about this yesterday, you all used the word calm. Do you remember that? Do you think that's important? That's an important thing to tell people about?
Yeah, it's so much more quiet outdoors. It's so much more peaceful. The rustling of the leaves and the birds tooting, and it's so much more freeing and calm and delightful to be outside with all of the senses that have been turned on.
Yeah, because if you're outside, you get the sense, you have the wind blowing in your face. You have the wind blowing in your face. You can just relax, you can be happy. But whereas if you're in the classroom, you might get stressed doing the work, because it's like you don't have any freedom about the work, you just have to do it. And if you find it really tricky to do, you might not be able to do it. But whereas if you're outside, you can find different ways to do it, and it probably won't be as stressful. Yeah, and when you're outside, you can work with other people or on your own. But when you're in the classroom, you either go with the person next to you if they're there, or you're just trying to figure it out yourself. But when you're outside, you have lots of other people, and it's just better.
That's so amazing. I have a feeling we probably, I hope that's given everyone a real flavour of why we work with these experts, because they're so articulate and reflective about the benefits of the work and what it means for their health and well-being. And I hope you get a sense of how they're flourishing doing this work.
Absolutely. Oh, that was fantastic. Thank you so much for sharing your thoughts with us. And I do think all of us could do with a bit of calm now and then. So it's given me some ideas myself. Thank you so much for sharing what you do and how much you've enjoyed it. And it's great to hear about imagination and creativity. What we'll do, we're going to move through different speakers now, and there'll be time for some questions in the sort of second half of our webinar today. But I know there's lots of comments for the children about how brilliant you've been. So well done, everybody. I'm going to move on to the next short presentation now from 2.8 Million Minds. We've got James and Claire, and they're going to tell us about their projects.
Morning, everybody. I'm just going to share my screen. Hopefully you shall see this easily. From the beginning. Is that working okay? Fantastic. So thanks so much for inviting James and I to speak at this important roundtable. We're going to do a double act, as you've just heard, a swift overview from me, followed by insights into the 2.8 Million Minds Commission, led by James, together with artists and young people. We were clear from the start that lived experience of young people must be at the heart of everything we were designing. This meant a purposeful slowing down of the process to ensure meaningful engagement. We started with a rapid deep dive to help us reveal the companies involved across London and their programmes. From this, we were able to identify difficulties with referral pathways, lack of clarity in how to find and then connect the need to resource, negative impacts of project funding, coupled with urgency of need and a lack of resources and capacity to respond. Using this information, we created a structure for Thriving Through Culture, which is a programme of inquiry and action over the next 3 years. This includes 4 areas of work that you see on the slide here: an action plan, festival for World Mental Health Day, new resources, and also the recruitment of an advisory group over the 3 years. The most critical of these is the development of an action plan. And we published a call to action in summer 2021 to create the plan through consultation, and we're hugely lucky that James Leadbitter, Chisenhale Gallery and the Bernie Grant Arts Centre responded to the call. So where are we now? 2.8 million minds manifestos launches today at the Houses of Parliament. And James will now speak about that process and some of the insights. Important to note, this work is urgent. We can't do it in isolation. The central role of artists and young people have enabled us to look anew and find different perspectives for solutions. This has been critical. Over the next 4 months, we're inviting people from all parts of the systems to join 2.8 million minds movement for change, to support young people to thrive through culture.
And thanks, Claire, for that intro as well. I'll move on to the next presentation, and we have Julie from Greater Manchester Combined Authority, looking on my screen, I think. Ready? Yes, sorry, there you go. Over to you, thanks.
Hi everyone, I'm on Claire's laptop. I'm in London today because Claire and I are working together on how we can share learning and collaborate across Greater Manchester and GLA. So I'm hoping, and she's just trying to find she's trying to find my
bear with me, Julie.
Okay. Have you got it?
Yeah. I'm just going to go back to here. So sorry.
Sorry about this. So I lead on creative health and Live Well. Live Well is one of the mayoral manifesto commitments to go beyond social prescribing, and that includes children and young people. It's a whole life course approach. So, okay, beginning. Is that a whole screen slide now? Yes, excellent. Okay, so all of this work, I'm going to talk to you about children and young people social prescribing in Greater Manchester and the role of culture and creativity. And where all this work starts is a commitment to address inequity. So the report for the Greater Manchester Independent Inequalities Commission has this sentence in it, which for me is really key to why we're doing this work and how we're going to do it. So we need to purposefully invest in the resilience and well-being of our people and our communities as part of an integrated place-based public service delivery model if we are to build healthy, prosperous places and lives. So place is key, inequity is key. And how do we address the terrible sort of inequities and the crisis in children and adolescent mental health at the moment, which has obviously got a lot worse due to COVID, but was present in our system before that. So part of the way we're doing that is we are developing the concept of Greater Manchester as a creative health city region. So we know that creative health contributes to reducing inequities across the life course. And that we know that creative and cultural activities can help us keep us healthy, socially connected, and also living at home. So we're creating a strategy which is structured both around that life course approach, but also clinical pathways. And that includes children and young people's mental health. And we've got Pat Taylor on the session today, and she's going to be talking more about that in a minute. So very quickly, we started looking at social prescribing, and when we started looking at this, we really found that it was very underdeveloped in terms of children and young people, and many link workers, so they're the people that are your connectors in the ecosystem that connect people with destination activities, said that they weren't really trained up, or they didn't really have the expertise to work with children and young people. So we started to think, well, how can we help to resolve some of this? What is it that we can build around? So we teamed up with the Association of Colleges and Street Games on a college pilot that they were running. So they trained up pastoral staff to become connectors, link workers, help develop pathways for support and advice for young people. What we were able to do is to put in some funding for a co-creation fund so that young people could start to co-commission activities, destination activities, work with local providers to commission them to either build on their enrichment programs in the colleges or to create new destination activities that young people could access either within the college premises or in the community. Why on the college premises? Well, we know that young people don't seek out support for their mental health. They often ask their peers and their families, and those people don't necessarily have the correct information to give them. They might give it with love, but it might not be the exactly correct information, and they might not have the information to hand of where to refer a young person onto. So we wanted to put that support, embed it in the college day, so young people found it easy to access. Of course, massive issue with this is particularly as COVID still extends into the education system and has going to impact for a very long time to come. That college staff don't really have much capacity. So what we've started to do now is we've started to try and find funding to put dedicated link workers into colleges to work with young people, to commission activity, and also to run their own group work activities, and to help young people to access the right support when they need it and where they need it. And the kind of outcomes that we're seeing from that work is better pathways for support and advice between colleges, primary care networks, and the voluntary sector. So that's the college where the young people are, the health system that might sit around the college, and also all of those voluntary and community organisations. Young people are telling us they're getting support where and when they need it. Staff feel more skilled to support students, and where there is a link worker in place, they feel there is capacity there to do that. Young people are getting more appropriate and faster referrals, and it's building on assets that are already in local communities, and also creating new assets where that's needed. And young people are able to access skilled staff as well as those staff being upskilled. But this is all well and good in colleges. So we started to look at, well, what about in schools? And we know there's a huge amount of work happening in different pockets of the country, and also that children and young people is a National Academy for Social Prescribing priority. But we had an opportunity to link with BeeWell in Greater Manchester, to use the data, an amazing and unique data set, and to create something a bit special. So that's what I'm going to talk about for the rest of my time, a couple of minutes. So BeeWell is
Claire, can I just say your slides aren't changing?
Oh, what have you haven't got a BeeWell head?
It should be changing.
We're still on your first slide.
Oh no. And I have pictures and everything.
I'm going to stop sharing and then reshare.
Maybe that one? Try that one. What have you got now?
Yep, we've got the BeeWell head, but we missed the few in between.
Never mind. I don't take up anyone else's time. So the BeeWell survey was created, co-created by 100 young people across Greater Manchester. It's a collaboration between the Anna Freud Centre and the University of Manchester and Greater Manchester Combined Authority. 60% of all young people in years 8 and 10, so that's equivalent to about 40,000 young people, responded to the survey. That's an amazing and unique data set that we've got. And there were some really strong emerging key messages. So the importance of physical activity, the importance of free time, the importance of places to go, and of there being community assets for young people to access. And the other major message that came across with the really broad inequalities, the data told us that quite broad inequalities in wellbeing across Greater Manchester, both between localities, but also within individual neighbourhoods. Which one? Right. So we designed a social prescribing pilot, which is a collaboration. We've received funding from Children in Need, Greater Manchester Mental Health Commissioning, and we've also got support. We're working with the Bridge organisation, Curious Minds. So this is our model, and actually I'm talking to you about something that's about to start. So we've just selected the neighbourhoods we're going to be working in. So we have, we're going to be training youth health champions in schools using the Royal Society of Public Health training, which is a level 2 qualification. So young people get an additional qualification. For some of them, it might be one of a very few that they get, because we are very specifically targeting young people who are not who might be struggling academically, or who maybe have practical skills, and all of the assessments are going to be done through portfolio. We've included in that a new creative health module for young people because that didn't exist. So we're just finishing signing that off now with the Royal Society of Public Health, and that's also going to be available as an individual standalone module, so for other people around the country to use. And that includes looking at barriers to participation and planning an activity with an arts organisation or cultural group. So we're training young people and equipping them with the tools, developing support and networks so that they can make a positive impact on the mental health and wellbeing of young people in their own communities and their own mental health and wellbeing. Just taking part in the training, we hope is going to have a significant impact on those young people, but it will trickle out across their schools and neighbourhood. So they each have an implementation fund. So each school has £5,000, but we are encouraging them to work together as a neighbourhood so that they can spend £20,000 on activities to support mental health and wellbeing. So they very much lead the process. As I said, there's a module which will help to train them in how to do that, and they'll be supported through that by Curious Minds and by the project management team. The idea is that they could come together to create a programme of activity across the neighbourhood, or they could have stuff embedded in their school days, or a mixture of both. Obviously, we don't know because it's co-creation. Co-creation takes time and it's risky, and you can't say at the beginning what's going to happen because then it wouldn't be co-creation. Young people lead mental health campaigns as part of getting their qualification. So that's the final part of their training. And the training essentially we're running as an can be run as after school clubs. So it's not embedded into the school day. It's run as an after school club, or could be done as a half term activity as well. So what we're trying to do here is co-produce models for young people based on what they prioritise, so using the data and then working with them through the training to really identify what it is that's important to them. And it's really key that in this model, it's place-based. So it brings together schools, the voluntary and community sector, locality partners within a neighbourhood. So that's people with the local authorities, the public health teams, your children and young people's mental health support teams. So it's about integrating that support in and around a school. And we're going to be working with about 18 schools in 5 neighbourhoods. I'll stop there. Sorry for the problems with the tech. If you'd like to know more about that, we're already talking, myself and Claire, already talking about how we could maybe build on the work we're both doing and link it up, scale up, find ways to connect. Please do get in contact, and you can find more about GM BeeWell at the link at the bottom of the slide there. So thanks very much.
That's fantastic. Thank you so much there, Julie. Lots around co-production and place-based focus. I think it's fantastic. I can see people asking about being able to access slides and comments after the session. I'm sure some way we'll be able to work that out with the team supporting this APPG so that attendees can link into all of that. So now we're going to move on to Dr. Kat Taylor for her presentation, again based up in Greater Manchester, but over to you, Kat. Thanks.
Hi everyone, hi, so my name's Kat. I'm a clinical psychologist and I work in CAMS, so Child and Adolescent Mental Health Services. So I work directly with young people, but also at a GM level in the context that Julie's talking about. So I've just got 5 minutes and I'm just going to share a little bit about what Greater Manchester iThrive is and outline our Arts and Culture for Mental Health programme. So Thrive is the transformation of children's services that's happening across the country, and it's a way of working that uses a common language that works across the different specialties. So it's not just mental health, it's working with healthcare, social care, schools, colleges, the voluntary sector, sports grounds, churches. So it's a whole system approach that includes everyone that works with young people and families. So the idea is to broaden the offer to make it more led by the strengths and the interests of the children and families and the relationships that they already have. So it's increasing choice and decision making. So in these ways, the framework itself emphasises participation and co-production at all levels, whether it's assessment, whether it's at the intervention. So if you want to find out more about Thrive, it's led by the Anna Freud Centre, and we offer training that includes peer support. So that's just a brief sort of background about Thrive, and towards these values, we at GM iThrive have an arts, culture and mental health programme. We're 3 years into this, and there's not much research specifically looking at children and young people and families who engage with mental health services and the arts and culture. There is, however, as we know, a great deal of research suggesting that engaging with the arts and culture can improve well-being. So we're trying to make use of existing research and then make more. So in thinking about today, actually, it occurs to me that one of the main reasons that this programme came about was because the system or the decision makers had heard that young people talking about stigma and misunderstanding, and that was one of their main concerns. And so in Greater Manchester, the providers have responded to this. I think they've recognised that facilitating conversations about mental health using the arts and culture and not in a more clinical or medical language could be a big part of that. So what did we do? Firstly, we found out what we needed to do and how. So we surveyed our health colleagues and our arts and cultural colleagues to find out what was already happening, what links there were already there, so between arts providers and health providers, and what sorts of beliefs and attitudes people held, what kind of work do we need to do. I should say there's a rich history of arts and health in the Manchester City region. We then tested the reality of arts and health providers delivering together. So we formally partnered arts providers with CAMS to co-deliver, and we had a series of projects that were like blended models of intervention, and there are case studies available at Great Place. I'll put links in the chat. We worked in a unique partnership on an evaluation kit for arts and cultural organisations. So we work with researchers, academics, clinicians, young people to try and identify a practical minimum kit of outcomes. So we ask users of the kit to collect information such as waiting times, attendance rates, cost per child, and we tried to make the decision-making processes really clear to arts providers so that they could help them, so we could help them articulate their value in a way that commissioners can use, and then also to compare to NHS interventions. And this has been requested by over 80 organisations across Greater Manchester. The third thing we did, we share knowledge and research to train the workforce. So we have 70 colleagues in Greater Manchester that attended our first workshop on implementing cultural options. So these were commissioners, service managers. How can you actually do this? Which really shows the interest and the appetite. We have 160 arts and cultural ambassadors across GM, and these are people in the workforce, and then they receive a monthly resource pack from us that helps them embed this work. And we also have a systems level working group to drive the aims of the programme and broaden it into wider programmes. So we work with the Violence Reduction Unit and BeeWell. I can see people asking for links. Yes, I'll put lots of links in. It's hard to get this into 5 minutes. So we support co-production at every level, but it's forums like the working group, the systems level working group, where there can be barriers. The methods that we use, the technical language that people in the meeting uses means that lay people and young people can't really be adequately engaged in that particular meeting. So to overcome that, we work with wider providers such as Bernardo's and youth forums to consult separately and get that fed back in the meeting. So we're always thinking about what young people and parents as well, really important, what parents say and what they want. I think another thing about co-production is listening to the research. So I worked in research for several years, and with adults with mental health difficulties, adults with dementia, and people reported the same thing, that their art making was a helpful tool for emotional regulation and a range of skills and experiences, but that it wasn't viewed by services as important. So the fact that I'm here today is based on listening to service, the programme is based on what service users have said. And I think, so in BeeWell, 3 out of 4 children in year 8 at the moment in Greater Manchester never or rarely go to a gallery. I think when we know that, that's something, there's actions that we can take based on that data set. And lastly, I was thinking about today, and I think it might be sensible to mention, so this has come up a few times this week, when we first sought to implement an arts and culture programme for CYP mental health, there was no kind of place for it, and the money ended up coming from slippage, right? And I've seen this happen a few times with these when something's not quite well established enough to have a job role or a job spec out there, but there's clearly work to be done. And I'm saying this to encourage others to approach management and ask, where's our arts and culture programme? Do we have a lead for that? And see what you can do. So thank you very much for having me. I'll put lots of links in the chat.
Brilliant. Thanks, Kat. And again, we're hear you talking very much about the system and making sure it's accessible and people use language that people understand, etc., etc. I'm sure others will want to ask questions later on at the end of the session. Just going to move on to the next presentation from, is Jessica here? Yes, I see Jessica Roos, BU Health and Wellbeing Service based up in Shropshire. So over to you. Thank you.
Lee, thank you very much. So I just wanted to say thank you for having this on this morning and for inviting us to come and speak. It's really good to hear from so many other people and just hear that we're all kind of, there's so many themes and they're all linked together in different ways, and that kind of makes it feel like something that's really quite kind of exciting and active to be part of. So I'm here in my role as Quality and Governance Lead for the BU service, which is the name that the children and young people in Shropshire, Telford and Wrekin called our secondary mental health service in Shropshire, Telford and Wrekin, with Midlands Partnership Foundation Trust. So my background is I'm an occupational therapist, so I'm quite keenly aware of how we think about kind of activity very broadly as being something beneficial for people's health. So what we were struck by, and in the context of the pandemic and increased need for eating disorder services for children and young people in the area, post-pandemic there's been a real significant increase in people presenting with those sorts of eating distress needs. We were struck by the fact that there were young people who were waiting for treatment. And so this is a really difficult time for somebody who needs a really specialist intervention, and they are sometimes waiting to receive that. And we were really mindful of the need and of the quite unique experience that is for a child and their family or their carers. So this in the context of the social prescribing and personalised care sort of initiatives that are growing kind of behind us and underneath us, and that we're trying to thread into our work in the system. We're mindful and thoughtful about how could we bring these things together? Could we use service user involvement and expert by experience kind of initiatives and ways of thinking to develop some unique solutions to these problems? So what this has involved is a co-production group where we've started to understand from those experiencing being on a waiting list for a specialist intervention what that's like, to understand what the needs are and to see if those young people had creative solutions for that. And what this has led to is a piece of co-production, which is co-facilitated by an art facilitator, where they're producing a resource that would be sort of owned by those young people to pass on to somebody who's in the shoes that they were in. So this is something that provides hope for recovery, because this is a group of people who have recovered from mental health difficulties and eating disorders have designed something that they think that they would have benefited from. And this is something that we would like to be able to develop. We will be evaluating with their help and with them in the driving seat, and use that to inform how we make services better going forwards. So I just wanted to give a very kind of broad overview, and also to pass over to Katie, who's one of our experts by experience, for her to provide some of her kind of insights really on this.
Hi everyone, I'm Katie. I was involved with the eating disorder service because I was being treated for bulimia and anorexia. I was discharged a few months after my 18th birthday, but I ended up progressing into private treatment so that I could get the intervention I needed. And then my co-production involvement came about just sort of talking with the eating disorders team that I was initially involved with, and sort of different trusts as well. So from my perspective, co-production has been really impactful because it allows us to be viewed as more than just our weights or our BMIs or the meal plans that we get given. And I think that we can patch up these shortcomings way more effectively if we've got all our different voices helping out to put one resource together. And I think the best recovery process needs to be accessible for everyone, regardless of privilege, because I had private treatment. That was only because I could afford that, and that's not common. So with co-production, I can work with the service users and the service itself to get past these miscommunications and just make it more positive for everyone, because the conversations are rapidly changing in younger generations, and we're starting to reject diet culture and addressing our fat phobia and incorporating wellness and health like very far away from just our weights. But these are conversations that are had online and in our bubbles and our peer groups. But people working, the professionals working with us at the moment, they are slightly misinformed, and that ends up with negative communications that causes such massive declines. Like the smallest little wrong comment or wrong wording can just spiral, especially with eating disorders, because they're so competitive. But the ability to co-produce a resource that has everyone involved in the process, you know, you've got like friends, we've got us, the service users, our friends, everybody, teachers, then hopefully we can create like the most supportive and understanding environment possible. So thanks for listening. I'm going to hand back to Jessica.
Thank you, Katie. So yes, so this is something that's in its quite early stages, and we're really excited to see and to be able to kind of speak to people about what this resource is going to look like with our art facilitator, and to be able to see this as a kind of it's an authentic and quite organic kind of living sort of resource. I see it as, but we'll see if that's something that's shared, because of course people are presenting to services with needs, gaining treatment and moving out of that into recovery. And so we will continue to kind of feed those views into this resource and be able to pass that on as people recover. So thank you all for listening.
Brilliant. Thank you, Jessica, and thank you particularly, Katie, for sharing your thoughts on that. It's really, really excellent. I know lots of people appreciate that in the chat as well. So I'm just going to bring in our final speaker, Dr Daisy Fancourt, but then I'm very sorry, I'm going to have to leave, but Alan will facilitate the Q&A and the final half an hour of the session. So thank you everybody for your contributions. And so over to Daisy for your presentation. Thank you.
Thank you so much. So I'm going to be speaking about a new project which is called Inspire, which has just been funded by the wonderful Prudence Trust. And this is a project that's being delivered in partnership with UCL, the Anna Freud Centre for Children and Families, the Social Prescribing Youth Network, and the National Academy for Social Prescribing. And the whole project is designed to increase and evaluate social prescribing youth referrals from child and adolescent mental health services. I'll refer to those mental health services as CAMS from now on. So currently, many children and young people referred to CAMS unfortunately face long waiting lists. And during the time they're on these waiting lists, we know that 3/4 of young people experience deterioration in their mental health. So we know that many CAMS sites are so keen to offer things like social prescribing for those waiting lists, but they currently don't have the resources or the time or the right connections to design and develop and evaluate these social prescribing pathways. So the aim of Inspire is to overcome these problems and support CAMS sites in offering social prescribing as soon as children and young people are placed on waiting lists. So Inspire is going to have 3 different phases that are all starting this summer. Phase 1 will involve co-designing the CAMS social prescribing pathway for waiting lists for young people aged 11 to 18 with moderate mental health conditions. And we're intending to use the standard CAMS to link worker to social prescribing routes, but children and young people are going to determine the details of how this pathway works. So our youth advisory group is going to be meeting along with parents, guardians, link workers, social prescribing providers, and CAMS clinical staff. And they'll be designing together the resources to engage in. And they're also going to be designing solutions to complex issues like data protection, safeguarding, and governance processes. And by putting young people at the heart of this process, we're hoping that they'll be designing solutions that they're really comfortable with from the start. Phase 2 will then involve undertaking a trial to simultaneously understand if this social prescribing pathway is effective and also how it can be implemented best. So we'll be looking at the potential of the pathway to support young people's mental health, as well as supporting their families and the clinical staff. And we'll also be looking at issues like how acceptable, suitable, feasible it is, whether it's taken up by young people, how it's delivered, and the cost of that delivery across CAM's sites in England and Wales. Again, young people are going to be at the centre of this because they'll be co-designing research measures with us. And we're also going to be taking some young people on as co-researchers in the team analysing data. And then finally, phase 3 will involve assessing the overall potential for scaling this pathway nationally across CAM sites. So again, we're going to be working with children and young people to co-write scientific papers. We'll also be working with the Youth Health Policy Advisory Group to produce policy-focused reports. And with young people, we'll be developing social media GIFs, podcasts, vox pops, infographics, to try and disseminate more broadly amongst young people the benefits of this pathway. And we'll also be working with CAM services to deliver training and resources so that the programme can be scaled to more CAM sites. So overall, the goal of Inspire is to have a fully developed and tested model for embedding social prescribing within CAM's waiting lists that can be scaled nationally, bringing social prescribing to more young people who could benefit. So this will build on the fantastic pilots that have happened at single CAM sites already, but hopefully enable this to work at a much larger scale level. And by embedding young people throughout this process, we feel this is absolutely vital to its success. We're currently confirming the CAM sites we're working with for the study. So if there are any link workers or CAMS professionals who are on this meeting who are interested in being involved, do get in touch, and I'll put a link in the chat. And overall, we're hoping this project will increase social prescribing amongst children and young people, enhancing person-centred care and hopefully positively transforming the experiences of young people on CAM's waiting lists. Thank you very much.
Thank you, Daisy. I think maybe Rachel has already left, Alan, so I wonder if you could take over now.
Alex, can you do this? I'm having technical problems here. Do you mind doing it?
No, that's fine. Okay, so we're going to go to a Q&A session. It's easier for us if you put your questions in the Q&A box at the bottom of the screen rather than in the chat. I think there are a couple of questions in the chat, but I can see a question in the Q&A box, which I will ask first of all. So this is from Jenny Smith, and she says, we are launching a feedback co-production event to gather feedback on our young persons services. Any tips for getting young people through the door, how to advertise, how to get their attention on the poster, etc. So I think probably all of you have been in that, all of you who are organising projects have been in that situation where you're trying to find the best ways to engage young people. Does anybody want to respond to that question? If you want to turn off your mic and speak or put your hand up. Daisy? Yeah.
So one thing that's really important to us in Inspire and more generally within our research group is that when people are undertaking work that's an extra in their lives that they'll be having to give extra time to, including when these are children and young people, we feel it's really important to make sure they're being compensated for their time, whether that's being paid or receiving monetary vouchers. And I think this can give a real recognition of the value that they're bringing to projects and can make it particularly appealing for young people if this is recognised as a job or work experience, rather than just being asked for free support and advice. So that's something I definitely recommend.
Great, thanks, Daisy. Anybody else want to respond to that? Otherwise, we've got more questions here. We've got a question for Paula and Ruth. Do you work with one school or have you branched out to many schools, and how many children do you have in a group?
Well, CCI works with all sorts of mostly primary school and early year settings across the region. The reason we're focusing on here with Mayfield is because they're helping us with the co-creation of the resources for this branching out project, but the pilot is going to recruit 6 primary schools in the region to test out this training with the volunteers. So we work with as many as we can and in depth with a few, just because we've kind of been researching and kind of practicing with them. In terms of how big a group, traditionally the work's been about whole classes of children and helping schools see that actually these opportunities can be offered to whole classes. More recently, because of our work with sort of specialist partners like the Cambridge ACON project, we've been focusing on small groups identified by safeguarding colleagues and so on. So we've been working with, you know, groups of 10 to 12 of children identified by their schools as particularly needing this kind of support.
Thanks, Ruth.
Paula,
did you want to add something?
No, just that we've actually, you know, it can be scaled up as much as you want or scaled down as much as you want. We've actually had a whole school participating in a CCI activity in the past. It's completely mad, but we managed it. But we've the current groups are of about 15 and half the class in the morning, half the class in the afternoon.
Paula, you did say to me actually when we met before this event that actually one of the barriers, and this is perhaps a sort of side question, one of the barriers to this work spreading to other schools is actually perceptions of the curriculum and the fact that it can't be incorporated and achieve all the targets. Do you want to talk to that a little bit?
Yeah, absolutely. That's a common thing that head teachers in particular say to me whenever I speak about out and about and how we use the artscaping principles. How can you possibly fit this into your week? And I simply say to them, how can you possibly not fit it into your week? Because giving the children the experience out of doors equips them to better cope with the rest of the week.
And also, Paula, you've talked as well about the impact on sort of staff retention and staff recruitment and the parent relationship, you know, the kind of well-being benefits to the whole community is so profound, isn't it?
Yeah, so we're a full-time co-headship, and part of our brief as we pitched on our interview was that we were going to do this, and governors and parents have applauded us and thanked us because we did do this. And also during the pandemic, we were able to set activities that were related to arts in nature for the children when they were at home. And there's a whole, there's masses of work to do on this, masses. We were just talking earlier about the fact that children don't go on play dates anymore in other people's houses, and thinking about how we might sort of scale this up to helping families to play together after school on neutral sites.
Yeah, I loved one of the earlier conversations about you working with public health to train up champions. And I was thinking, gosh, you could imagine artscaper champions in schools being able to model this way of playing for both other children, but also families. I mean, it is profound how we are, as we meet children, how few of them go outside other than when they meet us. They just don't go outside. And that's such a loss to their lives.
Yes, thank you. I mean, this is rather a simplistic way of thinking about things, but a lot of what you're talking about is about prevention and preventing escalating problems in mental health, isn't it? It's a broad approach to supporting all young people. And I'm just thinking about another question, and maybe Claire and Julie might respond to this, or James if he's still here. Woody says, I used to work with young offenders who very often have poor mental health. Any tips on including these young people? So that we're sort of moving out of the system, the school system, and into excluded children and so on. Is there anything you could say about that, Claire, Julie or James?
Sadly, not from my perspective. Julie?
Not from what we're doing at the moment. I used to do that work myself, but many years ago. I think there's I'm not quite sure what the angle of the question is, but I think a really important thing is to manage risk, but to manage risk in a way to not be too risk averse, and not to try and put too many boundaries and borders around the work you're doing with young people because you're terrified of what may or may not happen. You've really, sometimes it's going to sound a bit hippyish, and I've got to trust the process, but I really do think you've got to trust the process, and you've got to be prepared to take risks. it's really important to look at different funding models and making funding flow in different directions, and it to flow directly to community groups and for local authorities and combined authorities to let go of some of the controls and reins on that. And I'm going to say the word trust again, but to trust communities and to trust the organisations who work on the ground every day with people to know how to respond to the issues that are there. So I think, yeah, funding is completely, also training. A lot of artists think they don't know how to do this work. They do, they just maybe need some reassurance. So some even just minimal training around common mental health issues for children and young people, how to hold risk and how to refer on, safeguarding. So quite a small amount of input can actually have a big impact on the workforce and the workforce's ability. And the last thing I'd say is then if you are a practitioner working with young people who are experiencing mental health difficulties, you also need a practitioner, that supervision like a mental health professional would get.
Kat, I wondered if you wanted to reflect on this a bit, because you're working, aren't you, you're working with arts and cultural organisations and obviously with mental health professionals. You are one yourself. Is there any insight you can give us in that sort of area of working collaboratively across the voluntary community sector?
Yeah, I think it's about preparation, really. I think there's something like what Julia just said about how a small amount of work can go a very long way. Just getting people in a room and figuring out preconceptions, even different training backgrounds that could potentially lead to clashes, but actually people are coming from different, whether it's playful or childish, that's because artists work in a way that are playful and a mental health provider might see it as childish. So there's lots of kind of tensions that might arise that you can easily work through before you put them all in the same environment. I think it's all been said, really. It's definitely about funding. It's political. People have asked in the questions, is this happening in the rest of the country? And Greater Manchester is the only one with an arts and culture programme, but it needn't be. This could. So I work in Lancaster and Morecambe clinically, but it's impossible to get it launched up here because we don't have the Thrive background. But yeah, I think that the barriers can be overcome just simply by getting people in a room and talking about expectations, really, and supporting people to understand each other's point of view.
Great, thanks, Kat. I'm just going to go to this next question from Anonymous. Hi, I'm a meaningful activities facilitator at MKUH, that's probably Milton Keynes University Hospital, I think. I predominantly work with elderly dementia patients. However, I am running an activity afternoon for young carers, and I was wondering if anyone has any ideas, tips with working with younger people to make sure they feel comfortable and safe whilst within a hospital setting. Jessica, I wonder if you have any comments about that, because you come from an OT background as well, whether you wanted to answer that?
Yeah, absolutely. I think it's about sort of familiarity. So if people are coming into an environment they're not familiar with, it would be about enabling them to be able to explore that and become more familiar with that space and have some flexibility about how they may even use the space that they've got available to them. I think to pull on the contributions from the primary school age children who are here about branching out and talking about them having that free rein to go and explore things and use their own sort of autonomy, I think that is quite empowering. And I think to make a success of that group for young carers in an environment and a situation that's unfamiliar and could be challenging because of that, I think you would want to give them some autonomy and hear their voice as well, and be guided by them. You might find that the environment is actually quite stifling, so if you could get outside and use something outside of that environment, that might be better. And I think it's about being very active wherever that is, so having lots of resources, lots of things people can do. It helps facilitate conversation and take the pressure off. That kind of like people sitting in a circle on chairs, I think, can be quite pressured. Yeah.
That's really good. Thank you. So many helpful tips. Ruth, you wanted to speak, and there is also a question directly for you, actually.
Yeah, I was just going to add that the work we've done with Adam Brooks Hospital and young people, and really reiterate what Jessica was saying about using the spaces that you might not notice are in the hospitals, but actually can be really rich opportunity. Just views out of windows and funny little tucked away gardens that lots of people don't know about, but we've discovered all sorts of spaces at Addenbrooke's just by asking people to show us places that they have found can give them a bit of respite from the environment, and then encouraging other people to go out there and spend time in them. So yeah, definitely look around and ask the young people what they're noticing. It's a really good idea.
Thanks, Ruth. And there's a question, I don't know if you can see the Q&A, but there's one for you and Paula, which is, your experts mentioned that they particularly like the lack of structure provided through the project. This was fascinating, I thought. They mentioned that they found this freeing, but they're asking, how did you differentiate the project for students who are perhaps neurodivergent and require more structure in order to feel comfortable?
Yes, so I piloted what we call Out and About 5 years ago. In fact, the children that you saw were in my very first class that did this, so they've now 5 years down the line. And it takes time, doesn't happen overnight, but the fact is they know that if they're scheduled for Out and About on a Wednesday afternoon, that's when it happens. It happens every week. So that's one thing, they expect it to be happening. The other thing is that they, for example, in the first year I did this, I took them to the same place it was a Monday afternoon then, every Monday afternoon all through the year. So they knew the time that it was going to happen, they knew the place that it was going to happen. And over time, I learned to realize that, first of all, I couldn't take a lesson outside that I would do inside. It had to be different. And I scaled it back and scaled it back and scaled it back until actually I went outside. They knew where they were going. They knew which day it was going to be on. And they knew the questions that I was going to ask every week, which was, what's the same? What's different? And they knew that they had 20 minutes to explore what we now call the secret garden. And then come back. We sat in the same log circle as we would do every week. We had our hot chocolate at that point, and they went round with the twig until it was their turn to say. And sometimes they needed support with that. Sometimes they didn't join the circle. That was fine. But having the same things happen in the same way allowed for all of our children to participate in their own way.
Yeah, it's like structure and freedom aren't in opposition, are they? You can provide structure, you can plan it really carefully, you can be really thoughtful, but you can also give space for that individuality that they're talking about, and that kind of sensoriness and so on. And
the first session that we had last week for the first branching out session, there in the class that they were working with, the artists, there is a child that is very, very neurodiverse and finds the classrooms and school particularly challenging, and yet his TA was in the session, doing the session. Our adults do the sessions with the children, and she was in tears at lunchtime because he didn't need her. He was fully taking part, he was fully expressing himself, and often, because they know the expectations, you actually wouldn't be able to tell who the children with additional needs are, because they're often the leaders. And you wouldn't be able to guess who they were. Doesn't always happen that way, but by far it does more often than not. So yeah, that's how I would answer that.
Thank you. That's amazing. Okay, so moving on to the next question, which I think maybe Jessica, you might be able to respond to, because actually Daisy has had to go and it might have been aimed at her. When working with young people on the CAMS waiting list, how do you manage risk if the team running the groups are arts and youth workers as opposed to being clinical? So again, it's this issue of the crossover between different professional groups. Do you have any views on that issue?
Yeah, definitely. I think it's a really valid kind of question, isn't it? And we think of, I think sometimes we think that maybe we would be opening something up if we were to make contact with someone, or somebody who wasn't a clinical staff or trained mental health practitioner would have contact with that young person who's waiting for a specialist intervention. So better not to contact them or to have any input. And I think we can understand where that that comes from. But I think really conversely to that, actually, it's more likely to be helpful for somebody. And so as long as that facilitation group is set up within a structure where we know how a young person can get support, if things have changed, then it shouldn't be something that we avoid just in case. I think that's a really unhelpful way of thinking about it. And actually, it's about being able to actively engage and positively approach things that can actually really reduce somebody's risk. So just to sort of illustrate that a bit further, so anybody who's on a waiting list for treatment have already got what we call like a risk management plan or a safety plan in place. So there will have been quite a clear discussion around and careful discussion around what those particular risks are related to their mental health and what to do to manage that, and who to contact, what to look for, what the signs might be if something is getting worse, and that would need to be escalated into maybe a different part of the mental health service, like a crisis team or something like that. That plan is always shared with the other people around them, and that would probably be shared in some way with the art facilitator group, for example. So it's about embedding that into the systems that are already there, and kind of us, I think, questioning really the thinking that goes on, which is, well, we're better off leaving them on the list doing nothing just in case, when actually I think we can think differently about that.
Yeah, I think this is really interesting territory. I mean, I don't want to put you on the spot, Katie, but I don't know whether you have a view on risk and young people. But this idea of creating a framework, creating a structure, and within that allowing freedom, that balance between creativity, the type of risk you take in being creative, and risk in terms of a health context is interesting tension, I think. Katie, what do you think about the risk? From what Jessica was just saying?
I mean, I have been in recovery for about a year now, and because it was such like a positive experience for me, I personally know that I know my boundaries. I know when I'm getting uncomfortable, if I need to speak to someone, and because that's facilitated in the group that I'm in, there was conversations around like sort of wordings that we didn't want to use, or specific conversations that just weren't to be had. And we all have like a contact point to speak to someone if we get uncomfortable. But I mean, just from my perspective, it's been like a really positive experience. And because I just felt really supported, and because those boundary conversations were had, I felt like that wasn't going to be an issue as such. And I know that there's multiple people I could talk to get help or support if I needed to, but at the current point in time, I don't feel like I need it.
Great, thank you so much. Okay, so the next question anyone might feel they could respond to. So this is about education, arts education. So is there any way that BAMA arts programs would be able to collaborate with CAMS or charities working in this space to form a module so that artists and designers could have the opportunity to be trained in mental health social prescribing, but not specifically art therapy? I'm an artist designer facilitator who would love to have the opportunity to have a little training in mental health, which would help my workshops. So this is, again, this middle ground, isn't it, between the perhaps more, we know about the training that's available for art therapy or any of the arts in therapies and occupational therapy, those academic qualifications which make you an allied health professional and part of the registered HPC, whatever it's called. So, but there are an awful lot of artists working in this space who don't have that formal training. So do you, particularly perhaps health professionals, Kat, Jessica, do you see potential, or Julie, you might have something to say about this, for that, for more shared training perhaps, or working with art students? Oh, yeah, Julie, do you want to talk to that?
Have we done? Just very briefly, as part of the Create Health City region, one of the first things we're going to do whilst we're finalising our strategy and delivery plan is to launch a Creative Health Academy. So that's a really interesting point, which I will take forward into our planning. So yes, watch this space, I'd say. It's obviously mostly for people from Greater Manchester, but if it's something like a webinar, for example, it's an online based training, there's no reason why someone from outside Greater Manchester couldn't access it. So I'll definitely take that recommendation forward. Thank you.
And just to say, I think Victoria's on the call, the Cultural Health and Wellbeing Alliance is looking at this whole area and trying to think of ways of formalising some of the training offers that are and aren't out there. But I would say that we perhaps as a sector have more connection with healthcare professionals training than we do with art school training. I may be generalising rather there, but I think there's work to be done in the arts training sector to support students to engage with this work. We've got lots of questions. We've got about 6 minutes left. If anyone can answer questions, actually type answers. If you see one that's relevant to you, please do, because there are some quite practical ones. There's one here which is, where can we place creative healthcare, or we might say creative health, in a preventative space so that we are being proactive rather than reactive to need? What could that look like in practice, and how could we engage the system to invest in this? So a big question, obviously we've heard about that work in schools. Another big area of activity, which you may or may not be aware of, is the whole notion of everyday creativity, which is really about encouraging awareness, raising awareness amongst the public of the benefits of engaging with creativity, whether that's, you know, knitting in a knit and natter group, or any number of individual activities or group activities, and how that actually might benefit your health and well-being. So I think on one level, it's about a campaign. That's my view, a campaign to link creativity to health and well-being in the way that physical activity is linked to physical health and well-being. But any of our speakers want to respond to that question about prevention, the whole sort of prevention space? Jessica? You've turned off your microphone. Did you want to say something?
Yeah, I will. Yeah, I suppose I was just thinking about kind of, you know, the Thrive model as being something that's guiding how we think about mental health provision for children and young people through all those different levels of the service, if you like. So all be that from that preventative sort of level all the way into more significant and serious mental health. I'm mindful that we think of that as the kind of getting more help, and we think about what services are available to people that they can walk into. So it's about those community resources and that, again, that place-based thinking and having locality-based organisation, and that is unique depending on the particular place that you're working in. So I work in Shropshire, Telford, Wrekin, and we have a really interesting, I think it's really interesting, but I'm biased, sort of population distribution, if you like. So we've got some quite dense populations in Telford and some really rural areas. We have to think very differently about how we do that and what is available to children and young people in that area. So where do children and young people go? Is it the youth centre? If there are those things, is that something that needs to be restarted? Is it around what the school offers? Is it around that space in the park and being able to provide those spaces there? Because preventative measures happen in everyday life. It's not something you have to go and particularly go and access. And then the other thing I wanted to say very broadly about this is around something called the mental health school teams, which is an IAPT, an improving access to psychological therapies initiative, helping to put mental health treatments, as it were, preventative efforts into schools. And I wonder if there's something about getting that link at that sort of preventative level between mental health and arts in schools.
Yeah, and I think there is work happening in that that I know of, particularly say in Gloucestershire. Paula and Ruth, you have your microphone off. Did you want to add something?
I was going to add that I suppose it's about building confidence with teachers, that this way of working, it's so relational. You know, the relationships that teachers talk so much about, how they know the children better, the children respond to them better, the relationships grow in such beautiful ways that the teachers feel more confident, I think, about how to support the children as a result of working in these ways. Would you agree, Paula?
Yeah, absolutely. Seeing the children be in nature, operate in nature, whatever the phrase is, you know, it's telling them a lot about the children that they were second guessing this before, and actually it leading to something else we do, which is spirals of inquiry, where every teacher spends 30 minutes 3 times a year one-to-one with a child, asking them about their learning, asking the children, that's quite unusual, I think. They've all, why haven't we done this before? We've been second guessing what the children need instead of asking them and watching them.
Yeah, we've got to get away from the labels that education wants us to, no one wants to be a label. So helping us know each other better is what this work can do.
Thank you, and that's a lovely point to end on, because I think this asking people what they need and what they want is sort of the thread through a lot of these presentations. I was actually going to ask Alan if he wanted to say a few concluding words, but he seems to have gone completely now. So I'm sorry he's having technical problems, and I'm sorry we haven't been able to answer all the questions in the Q&A box. But I think you've had lots of links and connections, and probably various people here have put in their email addresses and so on. And we will be getting permission to make the recording available to people who signed up to the webinar. We aren't going to make it public, but we will do that. So I'll just finish by saying a huge thank you to you all. Absolutely fascinating and really lovely to hear what's going on across the country and see those connections. And quite across the system, isn't it? We've heard from all sorts of different projects today.